Hello everyone, I'm Rina Janet Layog and I'll be reporting about sediment examination techniques. The techniques are sediment stain, cytodiagnostic urine testing, and microscopy. So let's begin the discussion. Sediment examination techniques. Many factors can influence the appearance of urinary sediment, including cells and casts in various stages of development and degeneration, distortion of cells and crystals by the chemical content of the specimen, the presence of inclusion in cells and casts, and contamination by artifacts. Sediment stain characteristics. There are different kinds of stains used in laboratory for urine testing. Sternheimer-Malbin. Its action is delineate structures and contrasting colors of the nucleus and cytoplasm. Function is identifies WBCs, epithelial cells, and casts. Toluidine blue. Its action is enhances nuclear detail. Function is differentiates WBCs and renal tubular epithelial cells. 2% acetic acid. Action is lyses RBC and enhances nuclei of the WBCs. Function is distinguishes RBCs from WBCs, yeast, oil droplets, and crystals. Lipid stains. There are two kinds of lipid stains used, oil red O and Sudan 3. Action is stains triglyceride and neutral fats stains orange red. Function is identifies free fat droplets and lipid-containing cells and casts. Gram stain. Action is differentiate gram-positive and gram-negative bacteria. Function is identifies bacterial cast. Hansel stain. Action is methylene blue and eosin Y stains eosinophilic granules. Function is identifies urinary eosinophils. Prussian blue stain. Action is stain structure containing iron. Function is identifies yellow-brown granules of hemosiderin in cells and casts. Sediment stains. Staining increases the overall visibility of sediment elements being examined using bright field microscopy by changing their refractive index. Elements such as hyaline casts have a refractive index very similar to that of urine. Staining also imparts identifying characteristics to cellular structures such as the nuclei, cytoplasm, and inclusions. Sternheimer-Malbin stain is the most frequently used stain in urinalysis, which consists of crystal violet and seraphinin O. A 0.5% solution of toluidine blue is a metachromatic stain, provides enhancement of a nuclear detail, useful in differentiation between WBC and renal tubular epithelial cells, also used in examination of cells from other body fluids. The addition of 2% acetic acid to sediment, the nuclear detail is enhanced. This method cannot be used for initial sediment analysis because RBCs are lysed by the acetic acid. Lipid stains. The passage of lipids across the glomerular membrane results in the appearance of free fat droplets and lipid-containing cells and casts in the urinary sediment. The lipid stains, oil red O and Sudan 3, and polarizing microscopy can be used to confirm the presence of these elements. Triglycerides and neutral fats stain orange-red in the presence of stain, whereas cholesterol does not stain but it is capable of polarization. The three lipids, such as triglycerides, neutral fats, and cholesterol, are usually present concurrently in the sediment, thereby permitting use of either staining of polarization for their confirmation. Gram stain. Gram stain is used primarily in the microbiology section for differentiation between gram-positive and gram-negative bacteria. So gram-positive bacteria gives blue color stain, then gram-negative bacteria gives red color stain. Its role in routine urine analysis is limited to the identification of bacterial cast, which can be easily be confused with granular cast. To perform gram staining, a dried heat-fixed preparation of the urine sediment must be used. Hansel stain. Polynuclear WBCs seen in a urinary sediment are almost always neutrophils associated with microbial infection. The preferred stain for urinary eosinophils is Hansel stain, consisting of methylene blue and eosin Y. However, right stain can also be used. Staining is performed on a dried smear of the centrifuge specimen or cytocentrifuge preparation of the sediment. Prussian blue stain. Episodes of hemoglobinuria, yellow-brown granules may be seen in the renal tubular epithelial cells and casts of free-floating in the urine sediment. To confirm that these granules are hemosiderin, the Prussian blue stain for iron is used and stains the hemosiderin granules a blue color. Cytodiagnostic urine testing. It is an accurate and indispensable diagnostic test for numerous urinary system disorders. Cytodiagnostic urine testing. Although it is not part of routine examination of the urine sediment, preparation of permanent slide using cytocentrifugation followed by staining of Papa Nicolau stain provides an additional method for detection and monitoring renal disease. Cytodiagnostic urine testing is frequently performed independently of routine urinalysis for detection of malignancies of the lower tract. A voided first morning specimen is recommended for testing, which is performed by cytology laboratory. Cytodiagnostic urine testing also provides more definitive information about renal tubular changes associated with transplant rejection, viral fungal and parasitic infections, cellular inclusions, pathologic cast, and inflammatory conditions. The urinalysis laboratory should refer specimen with unusual cellular findings to the cytology laboratory for further examination. Microscopy. Microscopic examination of urine is best performed. Laboratorians should be knowledgeable about the types of microscopes available, their primary characteristics, and the proper use and maintenance of these microscopes. Bright field microscopy is the most common type of microscopy performed in the urinalysis laboratory. Other types of microscopy are useful for examining of urine sediment are phase contrast, polarizing, dark field, fluorescence, and interference contrast. The type of microscopy used depends on the specimen type, the refractive index of the object, and ability to image unstained living cells. All microscopes are designed to magnify small objects such as degree. The details of the structures can be analyzed. Urinalysis microscopic techniques. Bright field microscopy is used for routine urinalysis. Phase contrast microscopy enhances visualization of the elements with a low refractive indices such as hyaline cast, mixed cellular cast, mucus thread, and trichomonas. Polarizing microscopy aids identification of cholesterol in oval fat bodies, fatty casts, and crystals. Dark field microscopy aids identification of Tryponema pallidum. Fluorescence microscopy allows visualization of natural fluorescent microorganisms or those stained by fluorescent dye. Interference contrast produce a three-dimensional microscopy image and layer-by-layer imaging of a specimen. The microscope. Primary components of the lens system are the oculars, the objective, and the coarse and fine adjustment knobs. The illumination system consists of the light source, condenser, and field and iris diaphragms. Objective to examine are placed on a platform referred to as mechanical stage. Procedure: care of the microscope. First step is carry the microscope with two hands supporting the base with one hand. Second, always hold the microscope in a vertical position. Third, only clean optical surface with a good quality lens tissue and commercial lens cleaner. Fourth, do not use the low power and high power objectives with oil. Fifth, clean the oil immersion lens after use. Sixth, always remove slides with the low power objectives raised. Seventh, store the microscope with the low power objective in the position and the stage centered. The different types of microscopy. Bright field microscopy. Objects appear dark against a light background is most frequently used in the clinical laboratory. Use of bright field microscopy for the examination of urine sediment can be present problems when the amount of light reaching the specimen is not properly controlled. Sediment constituents with a low refractive index will be overlooked when subjected to light of high intensity. Therefore, sediment must be examined using decreased light controlled by adjusting the rheostat of the light source, not by lowering the condenser. Staining of the sediment also increases the visualization of these elements. Phase contrast microscopy. The best contrast is obtained when the light that does not pass through the specimen is shifted 1/4 of a wavelength and compared with the phase difference of the specimen. Phase contrast microscopy provides contrast. It is accomplished by the adaptation of a bright field microscope with a phase contrast objective lens and a matching condenser. The image has the best contrast when the background is darkest. The phase contrast microscopy is advantageous for identifying low refractive hyaline casts or mixed cellular casts, mucous threads, and trichomonas. It eliminates the need to fix or stain living cells. Polarizing microscopy. The use of polarized light aids the identification of the crystals and lipids. Both substances have the ability to rotate the path of the unidirectional polarized light beam to produce characteristic colors in the crystals and Maltese cross formation in lipids. Elements seen under the polarized light microscopy are birefringent, a property indicating that the element can refract light in two dimensions at 90 degrees to each other. Polarized light is obtained by using two polarizing filters. Polarizing microscopy is used in the urinalysis to confirm the identification of the fat droplets, oval fat bodies, and fatty casts that produce a characteristic Maltese cross pattern. Interference contrast microscopy provides a three-dimensional image showing very fine structural detail by splitting the light rays so that the beams pass through different areas of the specimen. The advantage of interference contrast microscopy. An object appears bright against a dark background but without diffraction halo associated with the phase contrast microscopy. More extensive modifications to the bright field microscopy are required to perform this technique. Therefore, it is not routinely used in the urinalysis laboratory. Dark field microscopy, a technique used in a clinical laboratory to enhance the visualization of specimen that cannot be seen easily viewed with a bright field microscope. It is often used for unstained specimen, and in particular to identify the spirochete Tryponema pallidum, easily adapted for a dark field microscopy by replacing the condenser with a dark field condenser that contains an opaque disc. The disc blocks the light from directly entering the objective and the field of view is black. Fluorescence microscopy, a rapidly expanding technique used in the medical field today, used to detect bacteria and viruses within cells and tissues through a technique called immunofluorescence. Fluorescence is the property by which some atoms absorb light at a particular wavelength and subsequently emit light of a longer wavelength. Practical application in the laboratory is allows the visualization of natural fluorescent substance or those that have been stained with a fluorochrome or fluorophore to produce an image. So that's all for sediment examination technique. Thank you for watching and take care always and God bless you all.